Welcome everyone to the workshop, Case Study Pilot During COVID. My name is Natasha Pei and I'll be moderating the session today. As everybody's hopping on, and before we get started, I'm going to give you a brief overview of how to use the Crowdcast. So if you'd like to submit a question to the speakers today, please use the Ask a Question function at the bottom of your screen. You can also use that function to see what questions that other people have asked and upvote them, so we have an idea of what to prioritize during the Q&A period. To the right of your screen, you should see a chat box, and you can chat with other folks here as we go, and we'll be sharing links there. But to keep the flow going, please put any questions for the presenters into the questions box rather than the chat box. And before I get started introducing the presenters, I'd just like to ground us in the recognition that no matter where we're calling in from in North America, we're calling in from traditional Indigenous territory. I'd like to appreciate the many generations of Indigenous people for taking care of the land that we call home today. We're here talking about poverty reduction through basic income, and we cannot imagine a North America free of poverty without truth, reconciliation, and addressing Indigenous inequities, particularly experienced by Indigenous people, but all people of color. So I'm calling in from Quebec, Gatineau, Quebec, which is situated on the traditional unceded territory of the Algonquin and Anishinaabe. And as I'm introducing our workshop presenters, I'd invite you to share in the chat or hold in your heart in silence the name of the traditional land that you're also calling in from. So with us today, we have Gabe Scheck, who is the Chief Advancement Officer at LIFT. He oversees LIFT's development and communications team to build philanthropic support for the organization. As a member of the executive team, Gabe is also instrumental in contributing to strategy, management, and culture to move LIFT's work forward. Gabe lifts to ensure every parent can create a strong foundation for their children. And Helah Robinson is the Senior Vice President of Program and Strategy at LIFT. She oversees new program design and implementation across the organization's 4 regions. She works closely with the regional team to use member feedback, program evaluation data, and stakeholder input to improve LIFT services, design new program innovations, and maximize impact. So welcome to you both. Thank you for joining today. And I'm going to hand it over to you to begin your presentations.
Thank you so much.
Thank you so much, Natasha, and thank you all for joining us. Before we begin, one other acknowledgement. We're really appreciative that everyone's able to join us today, as certainly in the States, hopefully this time next year, made official, we'll be acknowledging Juneteenth. Which we're personally excited about and feel like it's long overdue. So thank you for taking the time to join us today, and look forward to conference being slated for another day next year. With that, we're really excited to share more about our work here at LIFT, and we'll start in with a little bit of background around how and why we do what we do, along with a greater detail on our work with providing direct cash to our LIFT parents, which we'll share about in more detail. First, a little bit of broader context here within the United States. Today, over 38 million people are living in poverty, about 15 million of whom are children. And the systems and the services here domestically that are meant to help, they're often focused too heavily on short-term fixes, not long-term resilience, and they're fragmented and difficult to access. This makes life complicated, and it becomes even more so when we're facing challenging situations, or what we call here the shaky ground moments. Moments in our lives when we may feel unsure or lost, or like the ground's about to fall out beneath us. Families from all backgrounds, well-to-do or not, face these kind of challenges as they work to build strong, stable, secure families. Challenges like losing a job, which is far too common, certainly these days. and it can happen to anybody. But the difference is that well-off parents will lean on their personal, financial, and social capital to navigate those challenges. For example, if they're facing a job loss, they can feel confident that their experience and likely educational background will set them up for success. They can lean on savings to cover expenses while they job hunt often. And they can leverage social connections to identify job opportunities and get their resumes in front of the right people. Families in poverty have those same needs, but they lack the same sort of safety nets more often than not. The very structures, moreover, that are supposed to actually support them often reflect a deep lack of trust and can perpetuate the cycle. At Lyft, we believe in families. We trust that parents know what's best for themselves and they can chart their own course. We take an intergenerational approach to breaking that cycle of poverty by specifically targeting parents of young children and empowering them to build these critical foundational components: personal well-being, financial strength, and social connection. Or, as we like to put it, hope, money, and love. During our 2-year coaching program, parents prioritize personal goals, they get results. 65% of parents reduce their levels of stress. 94% increase economic security. 95% build trusting relationships. Our formula works. Parents in our program meet monthly with a Lyft coach to set and achieve their personal goals. Goals like continuing their education, building their savings, or securing a better job with a living wage. And we reduce stress and increase financial slack by giving cash directly to parents, so they don't have to choose between their emergency needs and their long-term goals. We believe that parents are the CEOs of their families, worthy of investment. And we've designed an unrestricted cash transfer program to do just that. Helah is going to share a little more about that cash transfer program, where it came from, and how we leverage those learnings to respond to the COVID crisis.
Thank you so much, Gabe. All right, so getting into the meat of, I think, how we connect to this conference and the work that we're all trying to move forward. So from over 20 years of experience of working with community members and working with families across the country, across the United States, we know that coaching can be a very powerful way to achieve results and that it requires persistence. We also know that even the most committed parent or caregiver can be derailed by a job loss or an unexpectedly high bill or some other financial shock. And we also know that living paycheck to paycheck really leaves parents with very little money to, one, kind of like float that instability, but also an inability to invest in their long-term goals. So to really invest in making those steps forward on their charts and their journeys out of poverty. So in fact, nearly 60% of American households have household expenses that exceed their income. So that leaves very little wiggle room to focus on, let alone even pay for long-term goal attainment. And so that's why 6 years ago, a little over 6 years ago, we actually at Lyft began testing different cash transfer models in an effort to really meet parents where they are and support their progress towards long-term stability. So this is where we kind of started back in 2015 with this idea of wanting to help families build that financial cushion and have a little bit of that slack to ameliorate the instability that they were facing that could really throw off progress. So for 5 years, we tested various different cash transfer approaches in different regions across the country. So Lyft is a national organization, and we have sites in Los Angeles, Chicago, DC, and New York. And across our 4 sites over 5 years, starting in 2015, we tried out different ways of really giving out cash to families in an attempt to try and support them in this way. So these pilots included things like emergency response or emergency relief in times of need, small Slack funds. In this particular pilot, it was focused on supporting student parents. And then we also had a few different efforts around reimbursement or restricted use and match savings. Now, I'm not going to go into like each of the weeds of each of these details. We can actually talk more about them in discussion and Q&A if there are questions. But the highlight, the headline is really that each of these pilots unearthed really important lessons for us, both positive and also areas for growth. So, for example, our emergency relief pilot was really dependent on Lyft having access to the needed resources at the moment when a member needed it. And that is something that we could not guarantee. And so being able to be responsive and to be counted on was difficult in an emergency response with limited resources. In our Slack fund effort, in a small pot of resources that we made available to student parents, while this pilot was well-intentioned, it required and it put on members, and actually let me pause and say, Lyft, we refer to the parents and caregivers that we serve members. So if you hear me say that, that's what I'm referring to. So the small Slack fund, it required members to be in the driver to be the drivers of asking for that support and asking for the resources and the funds when they needed them and they wanted to draw down, which created unintentional barriers to accessing those resources. And then finally, our pilots around restricted use. So basically, in an attempt to try and learn from the Slack fund effort where we thought that one of the barriers of access was lack of clarity of how the resources could be used, we kind of swung in the other direction and tried to put some restrictions or more clarity around how resources could be used. So around rent, medical expenses, and education, for example. So restricted use in that way, or reimbursement models where members would purchase things or invest and then we would reimburse them. Those two different kinds of models introduced unnecessary administrative burdens on both Lyft staff as well as members, creating barriers to accessing the resources. But much more importantly, those efforts in particular did not demonstrate trust in families. It was signaling that it didn't signal the trust that we deeply hold as a core tenet and a core value of Lyft work, of trusting that families know what's best for themselves to make progress, and that they need and will use resources in the best way that they know how, and know those nuances better than anyone else ever will, more so than Lyft and the Lyft coach that they're working with. And that those models, the reimbursement model and a restricted use model, didn't demonstrate that trust. So based on these lessons, Gabe, you can move to the next slide. So, oh, there we go, good. So ultimately, based on these 5 years of pilots of learning and improving and iterating, we really identified 4 key components that we believe that an ideal cash transfer program needed to achieve. So first being, is it responsive? Is it responsive to need that could otherwise really throw families back into a cycle of debt or poverty? The second, is it easily accessible? Could families and members use these funds without cumbersome applications or needing to remember to take multiple steps to get access to the funds? The third is, does it actually help create slack? Does it help members build a cushion that relieves some of a bit of that daily stress and allows them to focus on and allows them to take those leaps forward that they otherwise maybe could not afford or don't have the bandwidth to focus on? And then fourth, but most importantly, does it demonstrate trust in people? Does it demonstrate trust in the members that we serve? Do we genuinely signal that we trust how families are going to use the funds? So based on these lessons, in 2018, we moved to design a cash transfer model that we could leverage and scale across our 4 regions across the country, giving all of our members access to this opportunity. And so ideally, our chosen model would check all of these boxes. However, moving from these small regional pilots to a national model across Lyft's network meant that we had to add a final criteria around feasibility. So how could we, as a nonprofit organization, how feasible would it be for us to implement this at scale? And so that meant we had to then consider things around logistics, around budget, and around some legal questions that we had to consider as when we were scaling it across different cities, different states, and different locations. So with all of this in mind, we designed what's called the Lyft Family Goal Fund. So as LIFT members, as LIFT families persist through our program, they're eligible to receive $150 every 3 months in unrestricted funds. So we have intentional conversations with families about how these transfers can help them make progress towards their goals. And we work with them to put plans in place to do so and to proactively plan for when these resources are coming coming their way. But we do not require that members spend the money on specific expenses or in the ways that we discuss with them in support and in advancement of their goals that we're working on them with, nor do we verify how members ultimately spend the funds. Again, kind of like based in that core value that we trust families and that they will use resources in the way that best supports their progress and their family's goals. So since inception of the Family Goal Fund, we have distributed over $625,000 to over 1,000 families, supporting their progress towards greater stability and security. Gabe, you can move to the next slide. But then last year happened, this past year, one of the most challenging years in memory. So this last year, the pandemic really hit LIFT families and families like the families that LIFT serves. Really, it hit these communities the hardest. It disproportionately affected communities that we work with. So many of our parents pre-COVID worked hourly jobs that were scaled back or cut completely due to the virus. So we actually reached out within weeks of quarantine last year, and we learned that within the first 2 weeks, over 70% of LIFT families had already lost wages or income due to COVID closures. And as a result, they started to struggle to secure childcare, to stay on track with bill payments, to buy groceries, to pay for healthcare, particularly in times of emergency, and then navigating all of the additional stressors and challenges that came with everything moving into a virtual world in communities where there was a significant digital divide and children who were in school. So a lot of compounding stressors that kind of hit disproportionately the communities that we work with. And these immediate challenges can compound into greater instability, such as loss of housing, which we're nearing the precipice of the end of rent moratoriums, which can and likely will continue long after the pandemic passes. So at the start of the pandemic, we really wanted to make sure that we were meeting families where they are and that we were being as responsive to their needs as we possibly could. So at the start of the pandemic, last March, we actually transitioned all of our coaching, which previously was in-person meetings, to remote coaching. So either video or phone meetings. And we did this we did this overnight. And so this seems like the norm now. This is the new norm, the new normal. But I'm really proud that LIFT did not close for a single day due to the pandemic. We also intentionally shifted our primary focus. So while LIFT coaching typically focuses on long-term career and financial goals and long-term stability and security, in this moment, we explicitly shifted to discuss shorter-term, immediate, and stability needs. So Gabe, you can move forward. So before the pandemic, the majority of our coaching really focused on long-term goals like education. But as you can see, our support on stability needs really more than doubled early in the pandemic. And as you can also see, this trend started to reverse as we adjusted into this new normal. But this intentionally following the lead of parents and responding to the stability needs early in the pandemic has really been pivotal. And the other really important thing that I wanted to draw out from this trend that we saw is in this pattern, we see a determination that parents have to both make ends meet for their family and tackle cycle breaking goals, even in the face of one of the most challenging situations that we've experienced. So this is how LIFT responded and followed the lead of parents in our services, and we're able to meet families where they are. We were also able to provide emergency cash relief during the pandemic, really leaning on our experience with the Family Goal Fund and the infrastructure that we had built to distribute resources and to distribute cash and funds that we had built because of our existing Family Goal Fund. And all of this is also building off of our belief and our trust in families that they know best what they need to succeed. That was the heart of what was behind the Family Goal Fund from its inception around getting cash to people. And so building on these lessons and building on this infrastructure that we had, in addition to the Family Goal Fund, we were able to fundraise and distribute $1.3 million to all of our members. So all of our members received at least $1,400, and $1,900 to those who we assessed didn't have access to the first round of government stimulus support. And so the first round of government stimulus support didn't reach a number of the families that we serve, potentially, for example, due to documentation status. And so we really tried to support those families. Now, in this past year, and I think we're going to talk about this in discussion and in Q&A, but in this past year, we have really seen a sudden and notable shift in how the field is talking about cash relief. Really recognizing the need and the value for putting unrestricted cash directly in people's hands. And this conversation continues to grow. So Gabe, you can move to the next slide. So as I mentioned, the communities that we serve, our communities' experiences over the past year were hit hardest and reflect the consequences of historic and systemic inequities that we must confront in order to truly break the cycle of poverty. So what you see on the screen is a quote from Lyft CEO, Michelle Roan Collins, our fearless leader, who really elevated. She said, a catastrophe like COVID-19 has unearthed the foundational racial and gender inequity that is built into our economy, and now is our chance to fix it. So the pandemic and the movement for racial justice in the United States has really generated momentum for us to really take a hard look at existing structures and to make different choices. And now is the time for us to leverage that momentum and not let it fade into the background. We really need to connect families to the resources that they need, and to do so in ways that demonstrate trust and work towards a more equitable system and a more equitable future. So before we transition into discussion, we wanted to end by just sharing a little bit on how we, Lyft, are trying to do just that at city, state, and federal levels. So just a little on that. So at the city level, we really believe in, and I think as we started this whole conversation, we really believe in getting cash and unrestricted resources to families, but also in the augmented value of pairing cash with coaching and with supports that can really catalyze progress moving forward. So in one example, there is a basic income, a guaranteed income pilot that just launched in Compton, California. And we are partnering with this effort to provide financial and career coaching wraparound supports to families who are receiving resources, who are receiving guaranteed income in that pilot. Really digging into the infusion of coaching in all of our work and in our belief of the outsized value of cash plus coaching, and being able to provide that support and that proactive, planful partnership in supporting families and using resources to help catalyze progress towards economic mobility. At the state level, an example of what we're doing is a partnership with the Economic Security Project's Illinois Cash Coalition. So in Chicago, in our Chicago region, our executive director actually sits on the Illinois Cash Coalition and chairs the cash committee on the Illinois Cash Coalition. So on this coalition, they're really advocating for a few things. For example, really trying to advocate for the city of Chicago to join Mayors for Guaranteed Income, which is a network of mayors in the United States who are advocating for guaranteed income and guaranteed income pilots in their cities. And then also publishing op-eds and open letters trying to advocate for a guaranteed income pilot in Chicago. And then finally, really the core, oh, not quite yet, Gabe. Oh, I'll get there. Finally, the core of what Lyft does as well in this space of trying to advocate for change is we are not a policy shop. We support families and we work directly with families. And so with that, we really try and elevate our insights, our data, our lessons learned from the work that we do. But really, it's families. It's the families that we work with that should be sharing their stories and be in the rooms and be at the decision-making tables. And so with the Illinois Cash Coalition, we're really doing just that. elevating member voice and members themselves testifying at hearings, for example, to advocate for reform. So for example, a member in Illinois in our Chicago region testified at the House Revenue Committee in Illinois for EITC reform, for the Earned Income Tax Credit reform, really sharing her lived experience of the barriers that she's faced, and the outsized benefit that unrestricted cash support can have on helping to stabilize and advance mobility. And now, Gabe, you can move forward at a federal level. So at a federal level, really trying to influence practice. So LIFT is actually, we are in the middle of a study being operated by the Office of Policy Research and Evaluation out of the United States Health and Human Services Department. That is, it's an RCT studying the efficacy of career coaching towards employment outcomes, with the intent of trying to inform and change practice in the TANF system. So this is a social safety net benefit that is provided in the United States that operates on a case management model. And this RCT, this study, is the intent is to try and shift practice across TANF agencies and TANF providers from more of a case management to more of a coaching and intentionally grounded in trust and trust of communities. So trying to shift practice from more of a case management to a coaching mindset is the intent of this study, and LIFT is one of those partners that's trying to make this case at a federal level. So that's it. That's a little bit of who we are, how we came to this space of cash to families, and how we're trying to move that work forward from the vantage point that we have of being trusted partners of communities, and then bringing that voice and their voice to the right spaces. So with that, we'll move to the next slide. Thank you. Please keep in touch, and we can move into questions and discussions.
Thank you so much. That was really interesting, and so interesting to see how a lot of your findings, I think, really reflect some of what we were seeing in Canada with some of the basic income pilots that we've done, and that you're able to take it even a step further to follow the families and identify some of these, 4 core principles or like really keys for successful basic income. Other people following along, I really encourage you to put your questions in the Ask a Questions box if you have them for Gabe and or Helah. I have a couple of my own. So just, as we were talking, I'm really interested in hearing, in your discussions with other nonprofits, what is their reaction when you talk about the success of unrestricted cash payments? What are you hearing?
I can start. Yeah, I'll start, and then I can throw it to Gabe. So I would say there's been like a real shift this past year. The momentum and the amount of conversation that's happening around this topic has just kind of ballooned this past year. I would say that when we first started this in 2015, there was a little bit of pitching that we had to do to explain why we were doing it, and to try and overcome some, and this isn't true across the board or all partners that we were talking to, but a little bit around fear of how resources would be spent, around what would the cash incentivize in terms of attendance and motivation of why folks would be coming to our services. Would it be for the cash or for like the value of our programming? One thing I'll say is, as we did this and as we learned, we were able to demonstrate from our evidence, from data and from our participation trends, that none of that was true. That regardless of, so our cash transfer component is on a 3-month cadence, and our average and our program model itself, the expectation is a monthly meeting. And even with the introduction of this 3-month cash component, families on average were coming to meetings every 29 days. So we weren't seeing long gaps between attendance, despite the fact that the cash was only coming every 90 days. And so there was a little bit of that early on in this conversation, but this past year, I think has just shed a light on a lot of the fractures that are in our system and the difficulty, and sometimes intentional difficulty, for folks to get access to resources that they need and that should be available in the existing system. And COVID just shined a light on these inequities and these how things were broken or how things were intentionally broken. And I think as a result of that, the tone has just shifted, and there's a different intentionality and a different belief in how we should be trusting people, and how not doing so is a policy choice. I stole that from Michael Tubbs.
Absolutely. Gabe, anything? Gabe,
Not on
to
that. I
add?
think Helah really said it all.
And so what were the reactions of people, of your members, of staff, when they learned about the launch of this program?
Helah, you should take that.
I would say somewhat similar, maybe less internally, less convincing. I think there was some trepidation around, a little bit around the participation question, a little trepidation there, and also trepidation around trust, because early, well, even now still, I guess, especially now with more CARES relief coming out, it sounds like a scam. It sounds like something to be fearful of, that when you get like an email that or a text or something that says like free cash, something to be afraid of, to be fearful of, and that's like a flag for fraud. And I think and I think some of our staff were concerned about experiencing that, and some of our members being a little skittish on that front. I think one of the values of, and one of the necessities, and I think this is a lesson learned if we're thinking about rolling out, how to roll out pilots or how to roll out new policies, is leveraging trusted community partners to be that voice and to share information that's coming, to lend that credibility. So I think one of the lessons that we learned was we had trust with the members that we served and in the communities where we are. And so we were able to leverage and build on that trust to create credibility as we were rolling this out, because it was, especially 5 years ago, six years ago, different and unexpected. And I think like now with more relief coming out, so too are the risks of fraud, as people know that there are more resources coming into people's hands. More efforts of identity theft and other types of like scams like coming up on the forefront. And so really leveraging our role as a trusted partner to support families in being safe, in how to access these resources, and how to kind of like be on the lookout for those needs. I will say that from a member's, so that's kind of from the staff's perspective. From members' perspective of when we first instituted this, for me, I think like the headline and the thing that I've been really struck with when we first introduced it was the demonstration of trust that it signaled to families that they did not feel and do not feel when interacting with other social services and other social agencies. That it terms that we use at Lyft are trust and dignity and respect, and this really put our money where our mouth was, and that parents felt that and could see that, because we did it in full transparency, and we heard that from families, and so it just that's what we heard from parents. I don't know, Gabe, if you want to say anything.
No.
And just following on that thread of trust and dignity, you had mentioned that you moved from a model of case management to a model of coaching. So can you speak a little bit about the difference between the two approaches for your members and for the staff?
Yeah, I'll do a little bit, but I've been talking a lot, so I can also throw that to Gabe. I mean, the difference really is in what we call member driven, but it's really about a few things. One, it's about truly members being in the driver's seat. So we do not dictate what their goals should be, what their targets should be, or what steps they take. We are partners in sifting through what are their passions, what are their areas of interest, where do they want to go, and then connecting to supports and resources that are available to help them overcome barriers that are in their way and to make progress. But they're in the driver's seat and they name what are motivationally held goals, versus a case management approach, which is much more prescriptive. And that seeps into everything we do, every resource that we provide, and every training that we provide to our coaches and how we frame that. So really being member driven, rooting our effort and all of our work and all of our training in a strengths-based approach and not from a deficit mindset. So really trying to leverage what strengths families have, because everyone has them that they can reach on, that they can leverage, including Lyft, to make progress. And then also what we call operating from a place of unconditional positive regard. So not assuming, not making assumptions, and checking your own bias when having conversations with families, because they might set goals or they might make choices that you don't understand, but that's coming from a family's context based on their experiences, based on their values, and recognizing that is that is valid, and that is what we are here to partner with them in making progress towards.
Thanks. And I was just going to say, Gabe, I wanted to ask you too about how the program and its learnings have changed, how Lyft talks about the needs of its members, and how has it impacted the way that you talk about your members with potential donors?
Mm-hmm. As Helah was noting, I think over the past year and change, there's been a sea change as far as how donors view things like unrestricted cash. Like there's just more openness to it. Although candidly, sometimes we'll see that an institution, less so an individual, will say, we want to support your work, but we need to ensure that our money goes toward your operating and not toward the cash transfers. And often that will stem from, I think, internal politics that isn't necessarily universally held across like a foundation or a corporation, as an example. So, while I think there's like a spiritual belief, sometimes there's inconsistent practice. But even within that, the tide is changing. Like we had an instance with a corporate donor where putting funding support toward Lyft served as an inflection point within their institution to decide would they be okay with putting their budget toward unrestricted cash. And the program officer kept the grant on hold as she fought an internal battle and ultimately won to make that shift. And it was, it is an institution that everyone on this call would know. So know that, I think even some of the biggest financial institutions within the States are starting to view this differently in really exciting ways. And we're proud to be able to bring that topic to the fore, so that it gets, I think, the merit that it deserves, and also provides an opportunity to actually make a marked shift in how some of the biggest institutions, are again putting their money where their mouth is, similar to how we thought about it as a nonprofit.
And I'll name one last thing. There's a lot, like we've been saying, there's such momentum right now. So there's a lot of evidence coming out now around the impact, the value of unrestricted resources. But early on, I think we were able to kind of like push on that, as Gabe was talking about, because of the evidence that we were building in our small model. So we don't require that resources are spent in any certain way, and we don't verify that they are, but we can see aggregate transaction data. So we were able to speak to, without being required, how do families actually spend resources? And it was on things like basic needs, food, but the majority of where families were putting resources was savings. And so kind of being able to point to that without being able to point to that, I think started to move the conversation, and now it's just ballooned in a wonderful way.
And so what's next? We have all of this momentum building, particularly over the last year with COVID-19. It feels like policymakers are listening to us. The average citizen is listening, or like nonprofits all over the business sector. We're all talking about basic income. And so you have this great foundational research. What's next, or what do you hope is next?
I mean, one thought, even just on the question that you're asking before, like, it's helpful, obviously, when certainly philanthropic institutions and philanthropic individuals are donating to Lyft to enable this program with our cash plus coaching model. But the real end game is taking this out of philanthropy's hands, right, and having it operate on a municipal level, whether in the states, whether that's city, state, or federal, and ideally all of the above. So what we recognize is, as Helah was noting in that last slide, we have an opportunity, I think, to contribute to various pilots that are out there to be able to lend greater credence to basic income, as the new normal, and blend it right with the research base that we've been able to demonstrate, because we've been able to track our members and show definitive movement, on long-term outcomes in a different sort of way, and where we have a stronger stance on this is one. Through some of the capacity building work that we're doing in different sectors, we're infusing our coaching model, and in many cases weaving in unrestricted cash as part of that, in Head Start centers, working with local TANF offices, as Helah was noting, to have them move from case management to coaching, and just start again to show there's a different way that we could be operating systemically, that is not even it doesn't require seismic change necessarily, like from an operational standpoint. It requires a shift in mindset and approach, but this isn't necessarily outsized cash investments. It's just reworking the foundational underpinnings of trust and dignity and building relationship in a different sort of way.
And what came to my mind when you were like, what's next, is exactly what Gabe just named, to kind of continue to build the evidence and build the momentum, but really moving from pilot to policy and taking it from small private and or nonprofit like demonstrations to operating at a scale that none of us can do in a silo, that can only be done at that level of government. And in doing so, also thinking about the system that surrounds cash resources and other benefits, and trying to mollify kind of like that system as well. So in the United States, when trying to implement pilots or thinking about policy, at the same time considering changes to asset limits and income limits that would create barriers to accessing other social safety benefits that could be impacted if and when basic income is received. And so thinking about like the system that exists around receiving these resources and trying to address for that while also moving forward at a bigger scale.
So keeping that in mind, what are your closing thoughts for other nonprofits who are interested in basic income?
I would say keep resources unrestricted. Trust the communities that you're working with, and work with your constituents, with your clients, with your folks, et cetera, in a way that puts their voices at the forefront to move this forward out of your location, out of your purview, and into the broader sphere. Yeah.
I think that's well said. And to add on to it, I mean, know that Helah had that slide on the history. It's complicated. It's hard.
Yeah.
Even just from a sheer logistical standpoint, and we've learned a ton around the sheer operations of making it happen. So know that there's a lot to learn along those lines, and we're happy to share to the extent that you're thinking through it. And
that was going to be my last thing was don't reinvent the wheel. There are people out there who've hit these road bumps, who've hit these challenges, logistical and otherwise. Like reach out, ask questions as you're designing, and take us out, Gabe.
No, and I think along with it, really thinking about what is the holistic support that goes along with it. Like this doesn't happen in a vacuum. And obviously we believe firmly in the power of relationships and a lot of the complementary components that can go along with unrestricted cash to be able to accelerate the utility. Like and putting whether it's parents or other individuals putting their strengths at the forefront, but thinking through what is that total component, vis-a-vis, in this case, your nonprofit's work, so that this doesn't sit in a silo, but it really is woven into everything that you're doing as an organization.
That's great. Thank you so much for presenting your work today. And thank you for everyone for joining us. I have a couple of closing announcements. I just put in there in the chat box. If you would like to continue the conversation on basic income, you can head over to the QMO space during the break to network, socialize, and view the artist exhibits. If you enjoyed the session, we have more coming up, so please check out the conference website for the full schedule. And both of those links for QMO space and the full schedule are in the chat box there. The next keynote sessions are the intersectionality of basic income at 2 p.m. Eastern and pilots data and the drive towards cash policies at 6 p.m. Eastern. So we hope you can join us. Have a great afternoon or rest of your morning, wherever you are. Thank you, and we'll see you in the next sessions.
Thank you so much.
Take care, bye-bye.
Thank you. Thank you for the opportunity, Natasha. And before folks go, know that we are growing rapidly. And to the extent that our work is something that you're interested in bringing to your city. I just saw in the chat, hello from North Carolina. Please don't hesitate to reach out to us. We want to ensure that we can leverage what we're learning and expand how we're doing what we're doing in new places.
Great. Thank you. Take care.
Thank you.
Thanks, everybody.